So over the past few days here at summer camp, we've heard the term participatory medicine used many times. So my first challenge to you is how many people can actually say participatory medicine 3 times in a row, 8 o'clock in the morning? There you go. Glow sticks for you. So we've heard that the traditional medical model, the traditional paternalistic medical model, has been disrupted with the emergence of the engaged patient, the activated patient, the equipped patient, the educated patient, where the networked patient is shifting from being a mere passenger to being a co-driver of their healthcare. And we understand the convergence of the day-to-day life expertise of patients and the medical expertise that a clinician brings to the table. And so what is participatory medicine? Essentially, participatory medicine is a model of collaborative healthcare that seeks to achieve the active involvement of patients, clinicians, caregivers, researchers, payers, healthcare systems, pharmaceutical companies, and others across the continuum of care. It's where we come to be equal, to break down the silos and have conversations. Medicine X is a place where we've had great conversations, and the Society for Participatory Medicine is a place to continue those conversations. We need to move the conversations beyond this room, beyond Medicine X, beyond the Society for Participatory Medicine, and collectively, we can take action. Okay, so the Society for Participatory Medicine is based upon 4 pillars, including education, research, advocacy and policy, and community building. And so there's a place for everyone through channels like the Journal of Participatory Medicine, the ePatients.net blog, the social media channels, the forums, the interventions that we have planned. There are ways in which to continue those conversations. So we encourage you to take action. Now, thanks to Larry Chu, all of you had the opportunity to sign up for a 1-year complimentary membership. And if you didn't at the time of registration, too late, just kidding. If you didn't sign up during the registration, you can actually activate your membership at participatorymedicine.org/medicinex. So we encourage you to do so. So at the exhibit lounge, there's an SPM exhibit lounge outside. We ask that you record your participatory story, whether it's a medical story, whether it's the work that you're doing. We all have stories to share, and we want to move beyond my story and your story and make it our stories collectively. So I encourage you to take a look. So to begin, I'm going to introduce Dr. Alan Greene, who's actually going to tell his participatory story.
So my participatory story, my first one, started when I was just 15 years old, and I was in Guatemala. I spoke Spanish pretty well, and I was down there without my parents or without any organized group, and I had just decided that I wanted to become a physician when I got sick. And I got sick enough that I was hospitalized in a Guatemalan hospital that wasn't so elegant. And so here I am, alone in a hospital, thinking about becoming a physician, and at night, in this open ward, patients moaning in beds on either side of me, they come to my bedside and hang up a blood transfusion. And I had no idea why. What's going on with me? What's this for? Is this right? Is this safe? And my Spanish faltered. I couldn't understand them, and I couldn't make them understand me. So in the middle of the night, I screamed, "Does anyone here speak English? Does anyone speak my language?" And I realized that long night that frictionless communication is at the center of the delivery of healthcare. And as I went to medical school, I observed that often doctors and patients don't speak the same language and don't really listen to each other and certainly don't understand each other. And so I was one of the co-founders of the Society here for Participatory Medicine, S4PM. And it's based on 4 central commitments. It's shared data, shared feedback, shared resources, and shared decisions. And I can tell you in my practice as a pediatrician that every good innovation came from that sharing. Every good innovation came from listening to patients. They weren't my ideas, they were theirs. Whether it was from becoming the first physician blogger, all the way up to our cutting-edge house calls that we do in people's homes and schools and offices today, it was participatory. And S4PM is a place where health professionals and e-patients connect. It's where the conversations happen. And I want to especially thank you, Larry, I don't see you right now, but Larry, for not just for this amazing conference and for setting the leadership with having e-patient scholars front and center, but for making it possible for all of us to join and be in that conversation for free. So thank you, Larry. And I also want to bring up an amazing e-patient, Cady Mccurdy, who's going to tell her participatory story.
I gave part of this, I told part of this story last year, but I'm just going to give you the quick recap. So I've had 2 autoimmune diseases for about 20 years, and in the past 5 years, I've been having a lot of strange symptoms that I couldn't quite identify, and I call it kind of medical mysteries. So I was trying to solve some medical mysteries, and I was kind of doctor hopping, and I made an appointment with a new holistic doctor. And he didn't take insurance, so this was going to be a very, very expensive appointment. And I realized I had no idea how to begin kind of explaining my 20-year history with autoimmune disease and these new weird symptoms that I was having. So I'm also a user experience designer, and I kind of decided to solve this problem by creating a timeline. And I actually made 2 timelines, one of my autoimmune disease, which causes weakness, and one of my other primary symptom at the time, which was gut issues. So I made these 2 timelines, and they were up on the screen a minute ago. So they were kind of these visual timelines, and I printed them out and brought the timeline to the doctor and used it as a communication tool to explain to him what had been going on with me. And actually, this is just a little piece of it, but it went from birth all the way up until the present day. And that doctor wasn't super impressed with the timeline, but I found that it really helped me communicate my story. And since that time, I've actually taken it to probably 8 or 9 new doctor visits, and it's been just an extremely valuable tool to help me tell my story. So this was one way in which I've been partnering with my doctors and really trying to be an assistant. I think of myself as kind of their assistant. What can I do for my doctors to try and speak their language and kind of bridge that communication gap and also make information visual as well as verbal? So, yeah.
Thank you.
Thanks, Cady.
Thank you, Cady. Thank you, Alan. So I encourage you all to go share your participatory story, and to all, welcome to the Society for Participatory Medicine. Thank you.